Hi everyone, Dr. Lindner. Let's take a look at the salivary glands. The salivary glands are going to secrete saliva into the oral cavity. The oral cavity contains many salivary glands or buccal glands. The majority of saliva is produced by a large collection of the salivary glands located outside of the oral cavity. And the three pairs of salivary glands that secrete the saliva into the oral cavity are known as the parotid gland, which is just in front of the ear, and then under the mandible, the submandibular glands, and then just under the tongue, the sublingual glands. So if we look at it here, here's the parotid gland that is innervated by cranial nerve number 9, which is the glossopharyngeal nerve. Then we have the submandibular and the sublingual that are innervated by cranial nerve number 7. Okay, both of those are innervated by cranial nerve number 7. And just wanted you to see the parotid duct right here. And then you could see the submandibular duct right here. The ducts are obviously needed to get the secretions into the mouth to help to break down the foods. The parotid salivary gland, that's located in front and just underneath the ear, between the skin and the muscle called the masseter muscle. And the parotid salivary glands are connected to the oral cavity by way of a duct that's also referred to as Stenson's duct. And again, that's innervated by cranial nerve number 9. The submandibular glands, these are located beneath the buccal mucosa on both sides of the midline of the floor of the mouth. That's underneath the tongue. And the submandibular glands are connected to the oral cavity by way of Wharton's ducts. And again, submandibular is cranial nerve 7. And the sublingual salivary gland, that's beneath the mucosa, underneath the tongue. And it's above the submandibular salivary gland, but it is located under the tongue, sublingual, under the tongue. It too is innervated by the facial nerve or cranial nerve number 7. So the function of the salivary glands is to secrete saliva, and it's 1,000 to 1,500 milliliters of saliva a day. And in saliva, there's going to be water, there's going to be mucus that's involved to help soften and lubricate the materials in the mouth. There's salivary amylase, also known as ptyalin, and the salivary amylase is what initiates the digestion of starches in the mouth. There are some antibodies in saliva, lysozymes that control the growth of microbes. There's also sodium bicarbonate. Sodium bicarbonate is alkaline or basic, so it helps to neutralize the stomach acid that's about to enter from the esophagus. And then there are some ions that provide this fluid balance in the oral cavity. Cancer of the salivary glands and an accelerated growth again of abnormal epithelium. You see painless unilateral enlargement. Typically it's idiopathic. And again, they're going to treat it with radiation and chemotherapy. Now, involving the salivary glands, I think of mostly mumps and I think of stones. A salilith is a stone. It's like a calcium stone or a uric acid stone. It's typically painful. It's found on one side. It's unilateral. Idiopathic meaning no known cause. But you can see here's the maxilla, here's the mandible, and right here, we see something forming. You can see they're pulling it out right here. It's the removal of a salilith. Look at that. It's blocking the salivary ducts. Mumps That's acute parotid gland inflammation, parotitis, and it's typically caused by a viral infection of the parotid gland. It's typically bilaterally painful, enlargement, typically seen with fever and a sore throat. And again, it's caused by a virus. This is what mumps looks like. Okay, when we come back, we'll talk about the esophagus.